Hey everyone, it's Dr. Glenn Vo, Nifty Thrifty Dentist, and today I got a great guest. It's Dr. Garg from Implant Seminars. We all know him. I actually took my first implant course with Dr. Garg, his continuum, and that's actually how I got started along with everyone else. So Dr. Garg, thank you so much for being a part of this show today.
Thank you so much for inviting me. This is fabulous.
Well, Dr. Garg, the reason why I wanted to bring you on is because I had so many people, I put your deal out and so many people messaged me asking me about the center in the Dominican Republic. They're asking me about you. And I tell them, Dr. Garg is a legend. I mean, he's the man who started everything. And some of these younger people, they I guess they don't realize that there are so many implant courses out there. There are so many. I mean, you get on online, you see implant courses everywhere. And what they don't realize is that you're the one who kind of got the ball rolling. So I know you're kind of shy, each time I bring this up, but I really want you to talk about how long you've been doing this, how long you've been training dentists in implantology.
Well, I can tell you a little bit about that. I joined the faculty at University of Miami, the med school there, in the Division of Oral Surgery in 1986. So that was 31 years ago. And right about then is my chairman said, well, you got to pick an area of subspecialization. And he was doing head and neck trauma, and we had a guy, Dr. Mark's doing a lot of head and neck cancer. So my area, I said, well, I'm going to do dental implants. In the 80s, he said, well, they don't work. We tried them 10 years ago. I'm like, well, I don't have a lot of choice. And I picked implants. And then I realized there weren't good training programs out there. So in 1988, that's 29 years ago now, nearly 30 years ago, we said, let's us not just implement this here, but come up with a way to train folks. And we came up with a long-term continuum. It's the longest running continuum of its type. It's tied, when I said longest running, a Maxi course started the same year, and Carl Misch started the same year. So the three of us are tied for the longest running is programs. And that's what we did. I was based in Miami and Misch was based in Michigan, and Maxi course at that time was based in New York, and that's where we did this. And then later, it was so popular, we expanded this. We took it to Miami and Orlando and Atlanta and Charlotte and Washington, D.C. and New York and Boston, Chicago, Seattle, San Francisco, Los Angeles, Houston, Dallas, New Orleans, is about 14 major cities, is all over. So we've been doing this for nearly 30 years, have figured out a way to get folks trained systematically to incorporate these things into their practice. And at first, every program was lectures and model workshops, and that's what we did. Within a year, we said, they need hands-on, not just on models, but on human cadavers. Fresh frozen, not a bomb like we had in dental school and plasticky feel and the formaldehyde smell. Literally taken out of the freezer and thawed, as realistic as you can get. And we started that. And at that time, I mentioned it to Carl Misch that I'm going to do cadavers. It'll never work. And a lot of folks said it'll never work. And at that time, it was sort of groundbreaking, is to come up with this idea, which had never been done in dentistry or dental implants, and start using cadavers on a regular basis for training. And within 5 years after that, so now about 24 years now, we said beyond that, we got to get them live patients, because then they can see the blood, then they can have the patient moving and have it even more realistic. And what we did is we started live patient at the university, and each person got one patient. And then we realized that, with one patient, 1, 2, 3, 4, 5 implants, folks need is more implants. And so we said, let's expand this. And we opened up doing it abroad, and doing it abroad because we can get a larger volume of patients. Doing it abroad because of licensure issues, because in the U.S. you have to have a license in the state you're practicing. You can't just say, well, I was just there for a course and therefore I don't doing it abroad so that we can have folks that are hired local dentists that could then screen the patients, because it's very time consuming to screen them. It's very time consuming to post-op on them. And pay American dentists to do screenings and post-ops, it becomes very cost prohibitive because you're paying in US dollars. Abroad, you're paying in the local currency. And so you can generate that kind of manpower. And then we started doing that. Nearly 20 years now is live patient. And again, at first is to do this live patient. And we've gained a lot of experience over the time. As I said, we started with giving each person one patient, maybe 2, 3, 4, 5 implants. As we've tried 10, we've tried 15, we've tried 20, we've tried 25, we've tried 30, we've tried 35. We tried a lot of different numbers. What we found is that the sweet spot seems to be 20. Is less than that, folks just don't feel comfortable at all. It's just sort of a little teaser. Is more than 20 is an overkill. It just is redundant. And because there's always a cost factor, we can do more and more. So we've settled on 20. Anyone that says, no, I think I want to do more, they can make that decision when they're there and do more. A small extra charge for that. They can make the decision ahead of time. I'd like to go down to 25. I'd like to go down to 30. I'd like to do 35. Fine. We can arrange that as well. Probably 95 to 98% of the doctors stick with the formula that we've developed over these 20, 30 training, which is 20 implants for them, 20 implants for the partner. So between the two of them, 40 plus at the breaks and when they finish earlier than someone else or start later than someone else during the day, wandering around and helping and assisting on others. So directly doing 20, assisting the partner on 20, observing about another 20.
Well, I was talking to you before we came on here, is that you were actually, like you mentioned, you were actually the first one to do the cadavers. You're the first one to do the live patients.
Yes.
And now it just seems like everyone else is doing it. But, there's something to say about actually having your system and you've been doing it for so long that you kind of have it fine-tuned. You kind of know exactly what the docs need to be successful when they come home.
Of course, is first of all, the big difference between innovator and imitator.
Right, yeah, exactly.
The innovators, not the imitators. But what happens is, I remember the early years. I remember 20 years ago, and the little glitches that happened. And so, of course, if someone's starting today, they're going to have the same glitches we had back then.
Sure.
And over time, we refined it. And now it runs so smooth. Patients are pre-screened. We built a facility down there, and it's 3 floors. It's a freestanding building, front yard, backyard, side yards. And we have a total of 26 chairs, 5 chairs on the first floor because it's check-in on the first floor, and CT scanners and CEREC machines and lasers and such. On the second floor is 11 chairs, and the third floor is 10 chairs. So a total of 26 chairs, and that's the spread out of them, and we've got a full-time staff of 14 full-time dentists there.
Wow.
We have an American-trained and American citizen DDS and MD that's done also an oral maxillofacial surgery residency and a head and neck surgery residency. So he's an American guy, trained here, DDS, MD, oral surgery, and head and neck surgery. And he's there full-time, is there. We have a US-trained, BU, Boston University-trained prosthodontist there full-time. We have a Dominican-trained prosthodontist there full-time, a Dominican-trained periodontist there full-time, a Dominican-trained endodontist there full-time, and about 9 or 10 Dominican general dentists there full-time.
Wow.
So they're doing the screenings pre-op, they're doing the post-ops on the patients, is as per the specification that we're looking for.
So, when let's just go back to the course here. So when the attendees come down, the patients are already ready to go. They don't have to do the whole screening process, the whole, all those things.
The screening is not just looking at the mouth. The screening is looking at the mouth. The screening is doing medical history. Yes. And the screening is a mandatory blood test. Oh. Because what happens is I get a mandatory blood test, and I get a mandatory blood test for HIV and hepatitis. The incidence of hepatitis and HIV is the same there it would be anywhere else in the world. But when you're seeing this kind of volume of patients, when you're seeing 300 and 400 patients at a time, if it's 1 out of 1,000, if it's 1 out of 400, okay, and you got this many folks, yes, everyone's taking universal precautions, but this universal precautions plus.
Right.
Pre-screen them, mandatory blood test, and those are not put into this program. The folks anyone that ever tests positive is not put in the program.
So I want to
negative HIV and hepatitis negative.
So I want to ask you, as far as the patients go, how does that work for the patients? Are they paying to become patients? Is this pro bono, or how does that work?
Everything's done at no cost to the patients.
Wow.
What we do is the examination, the x-rays are no charge. Is the blood test, we have them pay for their blood test or their medical insurance or whatever their copay with their medical insurance is. So it might be $3 or $4 a copay. It might be $15, $20, okay? And I do that for two reasons. One, I don't want to pay for the blood test for them. That's not appropriate. We're going to do our part pro bono. But number two, that way they have a little bit of skin in the game. If they have paid for a blood test, if they've allowed themselves to get stuck, they're showing up for their appointment.
They're showing up, yeah.
They're showing up. So if we schedule 100 patients, 100, maybe 95, someone may have an emergency or something, but is the vast majority going to show up?
Well, I'll tell you what, I mean, you're doing a great service for the citizens of the Dominican Republic. I mean, I'm sure so many of them are now actually getting implants placed and getting their, teeth restored. So, I mean, that's very nice of you to do it pro bono.
And then we've got the 14 full-time doctors there and about 9 general dentists, as I said. They do the restorations afterwards. So it's not just, patting the patient on the back and here's a free transistor radio for being a good sport. Thank you very much. And leaving the country. No, it's truly taking care of them.
Wow.
What they do there is they take care of the lab fee when they get into prosthetics. So for the surgical portion, they take care of the blood test. Okay. We take care of everything that's in office. For the prosthetic portion, they take care of the lab fee, or if it's a CEREC crank, we do a lot of CEREC there, they pay for the block. Okay. Wow. The doctor portion of it, we do pro bono.
Wow, that's very generous, and I'm sure that the community truly appreciates that. I like to go back to the facility. I mean, that is kind of a groundbreaking thing to create your own facility. Okay, number one, doing it overseas. I think you were one of the first ones to do that. Now everyone else copied, but I think that you are actually the only program that actually has their own facility that's designated for your courses.
Well, like I tell you, we've always been the innovators. So we innovated cadaver, we innovated live patient. Now we innovated having a dedicated facility. And no, it wasn't an easy undertaking. I flew over about 7 times, went out with realtors and looked at different properties. And some that already built, some that needed is to add another floor, some that were just land, and different locations. I had a vision of what I wanted. I wanted it in a good area of town. Even the patients may not be wealthy, but I want a good area in town. So we got the best area of town, sort of the wealthiest neighborhood is the White House. Their White House, the president's house, is 5 blocks away from the facility.
Wow.
U.S. Embassy is 5 blocks away from the facility. A 5-star hotel that we use, the Renaissance Hotel, which is amazing resort is type hotel, is 5 blocks away from the facility. And so all of these things are 5 blocks away from the facility. One is 5 blocks east, one is 5 blocks west, one is 5 blocks south, and the hotel's on the water. And so these are some of the specifications I need. Is close to the highest end hotels in town, is close to the best areas in town, so we can go out to dinners and such easily. And we found this property, and then found an architect, and worked with the architect, and did drawings and plans and such. And I'd say about 98% of it came out the way we wanted it to. There's a few little things. Maybe I would have done this a little different. Maybe I'd have done this a little different. And we've had to modify. The front yard and backyard actually were huge. We've been in the facility now probably about 6 years or so in this facility. And is about a year ago, we added another building in the backyard. So now the backyard is still there, a little smaller. We added another building back there because we need more waiting room space because of the number of patients.
Wow.
And so on an average day, as far as surgeries, when we're down there, we usually fly down on a Wednesday, operate all day Thursday, Friday, Saturday, and either fly out Saturday evening or Sunday morning. And an average day is 100 patients get operated. 100 to 100
patients.
100 to 150 patients get operated.
Wow. I'm very curious. Do you keep track of how many dentists that you have trained to place implants? Do you have any idea? Because I've always been curious about that.
You can count things in different ways. You can count how many people have gone to live patient. Okay, I mean that's hands-on training. You can count how many people have gone through my continuum, which is the 4-session program, and we had tried different numbers. We tried 3, we tried 6, we tried 8, we tried 10 over the years, and we've settled on this. You could count the number of people at symposiums, and so it's tough to give a number per se. I went down and lectured in Brazil, for example, and we went to 4 different cities, and they had 2,000 dentists per city, and we lectured in 4 different cities. So you could say, well, I trained 8,000 people on that one trip. And so when people talk about how many people they've trained, it can be very misleading because yes, I trained 8,000 people on my one trip to Brazil over a course of 4 different evenings in 4 different cities. But that's not the question you asked. But that's how some folks, well, I've trained.
Sure, yeah.
What you and I are really talking about is either folks that have done full 1 year or 2 year residencies with me at the hospital, or folks that have done is extended continuum, 4 months, 6 months, 8 months. Mm-hmm. This type of thing is in our database, follow-up addresses and names and such. We have 14,000 names of such people.
14,000?
Okay. Wow. Now that is not counting, like I say, is doing 8,000 Brazilians.
Sure,
yeah. 2,000 French guys in one trip, or 1,000 Indians in one trip abroad.
So you've trained a good amount of dentists to place implants, basically. Well, I want to talk about
the longest running is, and there we kind of tied because a couple other programs that started the same year, 29 years ago, is with the largest by far is not tied with anyone. Is I'd say probably 80 to 85% of the folks that get trained in America today on dental implants is through our organization.
Wow, that's very impressive. So you gave my group a great deal. It's on the extraction course, and I really wish I had this deal. Oh, actually, I really wish you had the course when I did my extraction training, and I'm just gonna let everyone know how that went. Okay, I went to Guatemala. Okay. I already knew how to do extractions. I just wanted to do third molar extractions. But the thing is the course I went through, you can't pick and choose. The patient comes there, whatever they need extracted. So I extracted a lot of teeth, but it wasn't what I was there for. And as far as the accommodations, we worked in a gym with no AC, like a mission trip style. And look, don't get me wrong. If you're on a mission trip, then yes, that's how you do it. But I paid money to learn how to extract wisdom teeth, and I was still doing it in a mission trip style. The amazing thing about your course is that it's in this great facility. The patients are already screened. I had to screen it at the other course. I had to do the medical, all those things. I had to spend a lot of time away from actually doing the surgery. So in your course, there's AC, there's modern facilities, and there's enough faculty, and I think that's so great. But the deal that we have is the extraction and PRF course that's $400 off your normal price, which is very generous. And then there's the course that I wish I took is the third molar course. And that course, that's all you do is third molars, and that's $500 off as well. So I appreciate those deals. That's great. Like I said, I wish you had this course when I was doing it. I would have totally taken the third molar course and not waste a lot of time on the other course. So tell me.
With implants, since it's my passion of bone grafting, this I've been doing for, like I say, 29 years. The extraction course that I wasn't doing is 7 or 8 years ago when you went. And we just started doing extractions probably just about 2 or 3 years ago. Is folks in my implant courses are saying, can I come down to extractions? And I said, well, I mean, I'm not going to fly down for that. I fly down for the implants, and bone grafts is my passion. But we do have the full-time maxillofacial surgeon. I'm paying him U.S. salary. He's there. A month. So, okay, maybe not a bad idea. You get what you want. And, you get some mileage out of them other than just the 3 days a month that I'm down there. So it could be a win-win. It's for everyone. And we made it very, very low is the tuition, okay? Is when you probably went to your program, it was probably in the 6,000s or so for the extraction. We made it less than half of that, okay? It is under 3. And for the Nifty Thrifty, it's almost about 2,000.
Yes.
And we did that because the cost is very minimal is on extraction. The forceps are reusable, the peritomes are reusable, the luxators are reusable. The cost is on the bone because these folks do get bone grafted. They get bone grafted. So it's not just shucking the teeth and extracting them. You learn how to cure out the socket, you practice the bone grafting. They all get blood drawn and a PRP. So you hydrate the bone with PRP liquid. You make PRF membranes to put on top of it. So it's a great time to extract the teeth, but also to learn how to cure out the socket, also to the bone graft, also to either you or our doctors there or our assistants will draw the blood and you hydrate and put PRF membranes on top of it. And then what started happening is we've done that 2 years, maybe 3 years. And then a certain segment of folks, probably such as yourself, said, well, I want just third molars. And I asked my team, I said, can can you screen for just third molars? And they said, well, let's try it. I mean, let's see what volume. Let's suppose the guy takes 2 hours to do a set of wisdom teeth on the first day. He's going to operate 8 or 10 days. So he needs 5 patients the first day, second day, maybe 6 patients, third day, maybe another 6 patients. So each guy is going to need whatever that comes to, about 20 patients. Let's see if we can find it. And they did. And they did. So we started with a small number. I think we started with just 2 doctors or so to make sure we'd have enough patient flow, enough supervision. And we saw it went smooth, and we expanded, okay, let's try with 3, let's try with 4. It's still relatively small, is what we do there. And it is essentially all impacted. And the reason I use the word essentially, because if the guy has 4 wisdom teeth and 3 are impacted and 1's not, you got to pull out all 4 of them.
Right.
Say, no, I'm only here for the impacted. You got to take out all 4, okay? We're not trying to bait and switch. We're going to give you 4 non-impacteds, okay? And then it's essentially third molars. If the guy's got 4 impacted third molars and a bombed out second molar also, again, you got to do right by the patient.
Right.
Oh, I only signed up for third molars. I'm not touching that bombed out second molar. Well, you got to do right by the patient also. So that's why I use the words, it is essentially all third molars. It is essentially all impacted, because there's something nearby, you got to take care of that also. Okay, just to do the right thing by the patient.
I'll tell you, I mean, that's amazing. And I've always, I have a lot of young docs always messaging me and asking me, what's the best CE course? And I tell them, being able to extract teeth is going to bring you the quickest amount of money with the least amount of overhead.
Both of those, absolutely. Yes.
You do an extraction.
With the molar is the biggest profit generator.
Yeah, and then you do like with your course, you do a few extractions, you do a few socket preservation, pays for the course. You're done. You just do 2 of those, you're done. You pay for the course already. Same thing with the third molars.
With the Nifty Thrfity Deal and extraction course, yes. 2 patients, 3 patients covers it.
So obviously your specialty is in implantology, and I've been kind of I'm going to ask you again while we're recording here. So many people ask, what about Dr. Garg's implant course? He's the man with that. I'm like, okay, well, I'm actually going to be interviewing pretty soon, so I'm just going to ask him right here. So Dr. Garg, anything you can do for our group with your implant courses, so that they can train, so that they can follow in my footsteps. I took your continuum way back 7 years ago in Houston. And is there something that you can offer to help us out and get them on the road to placing implants?
Okay, we start with the implants, that's my passion. Then we start with these other live patient things, as I told you. Now we got soft tissue live patient, and we're about to launch a 6-inch veneers live patient. Is basically anything. Once you have the facility, we can do anything live patient.
Wow.
It has to be, because we have the folks to screen the patients. It would be a different instructor than myself, of course. We'd have to get the best in the country on veneers. And I'll share the name with you later once we do finalize everything, who the best in the country is that's going to teach that on veneers. We started a lot of what we call sort of subspecialized courses. Is oral sedation courses, is phlebotomy or PRP courses, Botox and fillers courses, and a lot of those. So we have about 17 different programs like that.
Wow.
On a lot of different topics. Those are things that I personally don't teach. We partnered with the best in the country. We partnered on the oral sedation course. And it's the 2 guys, Jason Goodchild and Mark Donaldson. They were part of the original 4 that were there at Docs.
Yes.
The guys that developed the much of the curriculum. They're the guys that developed much of the handout that's still used, and much of the curriculum that's still used by Docs. Docs is the company got sold a few years ago, and when it did, they split off. And when they split off, they approached us and said, we split off from Docs. We've got this curriculum, we've got these handouts, we'd like a home here. So we partner with them. We call it, instead of implant seminars, we call it oral sedation seminars. The Docs program these days is probably about $3,000. I told them my model is always to give better value. And I said, our model has been, if that's 3, it should be half that. So $1,499.
Wow, okay.
And then that's been our model from the beginning, is to do the same thing. And if it's half the cost, they don't delete every other slide from the lecture, obviously. So, well, we're gonna have as much, we're gonna do the whole package. And it's a lot of oral sedation. But you can't spend 2 whole days on oral sedation. Okay, the law requires it be a 2-day course. Some states requires a 3-day course, California, so we also have a 3-day version of it. But the law requires it. So they've added in a lot of other important things. How to use all those emergency drugs that are in your emergency kit. People buy the kit and have no idea what to do with it. What about folks that are herbal supplements? Which ones we need to be careful of and why? Is what about the medical history? What about bisphosphonates? What's the latest guidelines on bisphosphonates? So they've added in a lot of very, very important things. And then is pharmacology and these kind of topics can be so boring sometimes. They keep it fun. They keep it really interesting. It's a fun 2 days. They give a great handout, a textbook essentially. A lot of flashcard handouts on emergency. You can look at the cards and figure out what to do. And so that $14.95 course that others do for almost double that is, we could do this. Folks that sign up for the Continuum in July, we got to have some kind of deadline. They sign up for a Continuum in July. And what we do for the Continuums, I mentioned all the cities, since I do all of the materials, the whole 4 sessions, all 8 days I do myself. So the continuity of concepts, continuity of thought, not 8 different guys coming in and giving their own editorial concepts.
Right, right.
As you go, how do you manage that many cities? We don't go back to each city every year. We do each city about every 2 or 3 years. Okay, so for example, we may do Boston in 2015 and then again in 2018. Okay, we may do New York in 2017 and then come back in 2020. So that's how we can manage so many cities. So the cities we have coming up is Washington, D.C. is launching in the fall. Seattle is launching in the fall. And Dallas is launching in the spring.
That's my backyard right there, Dallas.
Yes. So for those 3 cities is anyone that registered in July, we would give them the oral sedation program, the 2-day or the 3-day version, whichever that their state required. And we should probably set up a reasonable time frame that they have to take that oral sedation. Let's say 2 years. Okay, they have 2 years to take it. I don't want folks calling me 10 years from now like, oh. So how does that sound? Okay.
That sounds great. So $1,500 free $1,500 sedation course. Wow. Well, thank you so much, Dr. Garg. I mean, that's very generous of you. And guys, you got to take advantage of that. And like Dr. Garg just said, if you live in those cities, it might be a while before he comes back. You said every 2-3 years, he just rotates the cities, correct?
And we have folks sometimes that go, oh, I thought I'd wait a year and I'd take it next year, and now I see you're not coming. I haven't stressed enough that yes, we come to these cities, but we don't come every single year. So you should jump on it when we're there, because we rotate every 2 years after that.
Well, everyone, I'm going to post this deal later once I post this video as well. And Dr. Garg, if you can just in the thread, if you can just post some pictures of the facility, because I'm really fascinated. I've seen you showed me some of the pictures. It looks amazing. I mean, it looks like a U.S. practice. And I guess it's for the
from here. All the 26 dental chairs are U.S. manufactured and shipped from here. The suction units is 3 suction units, 3 heads each, so 9 heads of whatever that means. And suction is the compressors all shipped from here. Is a whole container load. Is 2 brand new CAT scanners there, 3 CEREC machines, 2 milling units. Is of course lasers and all kinds of other things there. Yeah.
So I think for those of you who are just concerned about going overseas, which I mean I don't see why. I travel all the time and it's very safe. But for those of you who are concerned, okay, Dr. Garg's facility is in the nicest area. It's almost like being in the States. Okay, and once you see the pictures, and then also, Dr. Garg, if you can put the link of the hotel where I was at, once you guys see the hotel, okay, then you'll want to go. I'm sure your spouses will want to go. Okay, it's that nice down there. So, Dr. Garg, before I let you go, I know you're really busy, but any words of advice for a new doc who wants to get into implants, who feels like that it's just too overwhelming? What is your advice to them?
Is because that happens. Because what happens in any relationship, someone's taking a risk. New patient comes in, and if they're paying you full price, they're taking the risk that they may not like you. It may not work out. Is if you do it at no cost, is you're taking a risk because it may not work out and you're just kind of wasting your time. You can minimize risk, and that's what a lot of dentists do. They will have a low cost introductory offer, is to minimize the risk to either party. And so what we do is we do an annual symposium. I call it annual, but it's about 3 times a year. Upcoming is Miami in September. Then after that, the next one is February in Hawaii. The cost on that 2 full days of lectures is by a half a day on how to read a cone beam. It's nice to get a cone beam and talk about cone beam, but now what I do with it, you spent that $100,000, how to actually read the cone beam is a half a day by a maxillofacial radiologist is presenting. Wow. And on and on. And the tuition on that is $295. Okay. That's kind of like when folks do a $19 initial oral exam, this type of thing is a nominal cost, and come in we meet you, you meet us, you see about implants, you meet other people, some who are starting a journey or thinking about starting a journey, some who is halfway through the journey, some who are doing lots and lots of it. And so you talk to other people about it. It's not just to you, not just to me about it. So that'd be the way to get started, is symposiums.
Well, that's great advice. And again, Dr. Garg, thank you so much for joining me tonight and talking and addressing all these questions that all these docs had. And I truly appreciate it. And guys, I will post that deal on there. And then Dr. Garg, you can post the pictures of the facility and of course the link to the hotel so that they can see where these courses are going to be at, the hands-on courses. So Dr. Garg, thank you very much. I appreciate it.
Thank you. Good night.